right, everyone, we're going to break down some of these life-threatening illnesses here. And the first one we're going to talk about is cancer. So more than any other diseases, patients often think that cancer equals death, right? The following this reactions, different issues begin to occur based on the patient. So some of them will choose no treatment, right? Others will wonder which treatment option might be best. Which one should they choose as an option, right? Some individuals, let's think about the example of breast cancer. Some individual women will say, just go ahead, let's do mastectomy, get it done, while others will choose a less radical approach and say, okay, let's start chemotherapy, or I'm open to a surgery. However, I don't want to lose my breasts and I don't want to have a mastectomy. So some of them will want to look through their treatment options. And then a lot of them will be empowered by taking a role in this decision-making process, right? So it's important, especially with cancer, for individuals to find a really good oncologist and an oncology group. Those are the doctors that work with cancer. For those to understand the importance of having a doctor that will hear out your concerns and talk to patients about their options without forcing different treatments onto the patient. So the three most widely known treatments for cancer are surgery, radiation, and chemotherapy. Often treatment is somewhat of a combination of the three. They might try and hit the cancer from different approaches, and patients can experience some pretty major side effects from radiation and chemo. They take a lot out of a patient's body, right? They're often will have nausea, vomiting, hair loss, weakness. They may have dizziness. They're more prone to infection if they're on chemotherapy. Lots and lots and lots of issues. They may have inflammation and soreness to their mouth and their esophagus, so eating might become difficult. So lots of side effects that they need to be aware of when making these treatment options, these decisions. There are more up-and-coming treatment options. Some of these include like hormone therapy, stem cells or bone marrow transplants, different targeted therapies, and immunotherapies. And we're lucky to have St. Jude here, and they do a lot of these different treatments for our kids that are suffering with cancer. But more and more of these options are becoming more accessible to all of our patients and all of the different types of cancers that are out there. We mentioned some of these already, but some of the most common signs and symptoms of advanced cancer, and I talked about the signs and symptoms of use of chemo and radiation, but a lot of these are also symptoms of advanced stages of cancer. So think about a patient that doesn't choose treatment, and maybe they're just seeking palliative care. They may be experiencing weakness, loss of appetite and weight, pain, nausea, vomiting, constipation or diarrhea, sleepiness and confusion, and even shortness of breath, especially if they have cancer that is spread to their lungs. So even when there's nothing to do, meaning that we can't cure the cancer, there's still much to be done, right? There's still much to do in regards to caring for the patient, both emotionally and physically, right? Even if we can't cure something, that doesn't mean that we're done with that patient. They still have needs. They still have things that we can help them with in these terminal stages of life.